Good morning. My name is Andrew Gomes. Today I'll be doing a case study on Susan based on preeclampsia, pregnancy, and delivery complications. Firstly, we'll discuss what preeclampsia is. Prenatal risk for preeclampsia. The female reproductive system is complex and serves more purposes than the male reproductive system. It produces and delivers gametes, provides nutrition and safe harbor for fetal development, gives birth, and nourishes the infant. In this case study, we discover the complex sequence of Susan's pregnancy in conjunction to a 90-year-old consuming a high nitrogenous meat and potato diet and more carbs rather than vegetables, fruits, or dairy. We'll see how this affects her, and reason being synthesis and her digestion, delivering nutrition to her baby. Her first 17 weeks of pregnancy were uneventful, which at week 18 she was found to have proteinuria. Proteinuria is when there is protein excreted in the urine, similar to ketoacidosis, diabetic ketoacidosis, and this is dangerous, leading to less filtration and buildup of pressure in the kidneys, which results to high blood pressure. By week 22, she had high blood pressure of 150 over 100 milligrams of mercury and was diagnosed with preeclampsia. Laboratory results concluded her blood glucose level was on the high side of normal and that she was insulin resistant. So first we will discuss again what preeclampsia is. Susan was mindful and began to restrict her salt intake after mid-pregnancy. She did not gain any weight and showed signs and symptoms of common forms of hypertension during pregnancy. Some symptoms are high blood pressure before the second trimester, protein in the urine more than 2 to 5 grams within 24 hours, and generalized convulsions. Um, this entails Susan feeling these first time throughout her trimesters, and preeclampsia is very common, like diagnosis with a pregnant woman along with diabetes. So this is definitely something to look into genetically. A lot of blood tests were given, possibly low levels of cortisol and stress that could partake in this diagnosis. Within 36 weeks of Susan's pregnancy, she was given a cesarean section with risk of forming type 2 diabetes. Blood tests were done to monitor kidney functions, displaying the following: elevated liver enzymes, increased levels of creatine and bilirubin. Blood sugar levels are greater than 120 milligrams per deciliter. So this is a detrimental decline in her functioning and her physical well-being. Um, to bring these to stable, we have to monitor her sodium levels along with her um, water intake. Uh, the best option was a C-section for Susan because it was probably in her best interest in delivering the baby. We will definitely have to look into her postpartum partrum and making sure that she is able to function well, eat well, and also provide either breastfeeding and nutrients for the baby. Risks of preeclampsia in almost every mother and in almost every baby. The risk of preeclampsia are destroying the placenta. The risk of preeclampsia risk the placenta separating from the uterus prior to the delivery, swelling in the feet and legs and hands, elevated liver enzymes, low platelet count, hemolysis, which is the destruction of blood cells, risk of blood clotting disorder, risk of liver failure, and risk of kidney failure. In the baby, there's slower growth in the wombs due to conditions with lower amounts of nutrients and oxygen passed from the mother to the baby. C-sections of babies delivered before they're fully developed and can lead to serious complications such as respiratory problems caused by the lungs not being fully developed. Neonates can suffer detrimental declines in development, which may lead to fatal disasters. So the medical interventions that we're going to proceed with are the primary form of treatment for Susan would require medications with antihypertensive agents and androgenic agents, cardiovascular agents, neurotransmitter agents, peripheral nervous system agents, and sympatholytics. Vasoconstrictors can reduce the caliber of blood vessels, increase blood flow to the heart followed by preload, increases cardiac output, and it causes an increase in the release of aldosterone from the adrenal glands, which is extremely important for sodium and potassium homeostasis throughout pregnancy. Examples of these medications would include thromboxane and methyl-dopa. So mainly we want to make sure Susan's electrolyte balance, fluids, um, liver functions, and everything are okay based on the medications she received throughout her pregnancy, before and after the C-section. We want to make sure her bodily functions are good. She's taking a lot of fluids. Um, Preeclampsia is very commonly diagnosed in pregnant women, and it can last them for a lifetime, along with the diabetes. So these things can definitely be taken care of with long-term treatment and proper diet and lifestyle. I recommend that Susan um, does what's best interest for her baby, which she had done by lowering her salt intake. And this is very good that she was able to have a successful delivery. It's just I brought this case study to your attention because it's a very commonly diagnosed issue. The outcomes in the mother, the cesarean section 3 to 4 weeks prior of pregnancy, prolonging hypertensive disorder, which we would find treatment mechanisms for, and underlying diabetes that can definitely be controlled and managed. So yes, the case study was based on basically doing what's in the best interest for the baby and the mother. These are my references. I hope you enjoyed my presentation on pregnancy complications. Thank you.